I'm David Mills. I'm relatively new to the medical community here in Los Alamos. Been here since last July. But I grew up and was born here in Los Alamos, and so this was a neat opportunity to come back and practice here. I'm a kidney doctor, what I wanted to present today is some of the issues that are important to know a little bit about in kidneys in general, but also some of the specifics that are related to kidney issues in women. I'm going to also talk a little bit about urinary tract infections. Even though those aren't specifically related to the kidney in all cases, but they frequently can involve the kidney, and I think that's a subject that we can go over and mention a few important factors on. And so the name of my lecture is Kidney Disease in Women and Its Important Facts to Know. And so for my overview, I want to talk first a little bit about the role of the kidney, which is a little more sophisticated than a lot of us appreciate. I certainly didn't realize how fascinating it was when I first started medical school. I honestly didn't even know what a nephrologist was back then, which is a kidney doctor, and what I am. I'm going to talk about a little bit about some of the tests that we use to look at kidneys, at least the ones that we use most routinely, and how those tests would be interpreted in women, which needs to be interpreted differently depending on the patient we're looking at. And then also I mentioned a little bit about urinary tract infections that we'll go over. So starting out, the role of the kidney, the thing that most of us think about what the kidney does is it serves as a filter in order to remove toxins from our body. And that might be the toxins that our body creates on its own, or it might be drugs that we take. A lot of medicines are cleared from the body by the kidneys. But as it works as a filter, we think about a filter not just how well it's filtering in terms of how much is going through, but also how effective it is. And so when we talk about the rate of filtration, we'll be talking about a creatinine here in a moment, which is how we measure how much blood basically is being filtered by the kidneys. I threw in a picture of a gas filter here because I think about a gas filter in a car is it serves two purposes. Not only does it try and remove the junk and the sediment that might be in your gas tank or in some of the gasolines that we get, but it also has to allow enough gasoline to flow through it in order for the engine to run normally. Well, the same thing is true of the kidney. And it needs to filter the appropriate amount, but also when it filters, it's not supposed to allow certain things to show up in the urine. And so those can both be markers of kidney disease if the function is decreased, or if things which we typically think about protein and blood as things that we don't want to be seeing showing up in the urine with dysfunction in the kidney. But there's a lot more that the kidney does behind the scenes that we don't know about or we don't think about until the kidney function is so poor that it's not doing what it needs to anymore. It controls how much fluid we have on our body. So if you have ever swollen up before, that's the kidney that's determining how much fluid we have. If the kidney wasn't able to do that, whether we were dehydrated or overloaded with fluid, could go back and forth with insufficient kidney function. It controls how much acid we have in the blood, and the opposite of acid is a base, and that's measured in pH, if you're familiar with that. It also controls what are called electrolytes, and electrolytes are really, they're salts, but they're elements, they're ions, and the ones we think most about are the sodium, potassium, magnesium, and chloride, but also when we drop down here we think about calcium, phosphorus as well. Those are also regulated by the kidney, but they are regulated in a more sophisticated mechanism using vitamin D and something called a parathyroid hormone, which is important because the kidneys will actually activate vitamin D. You can take all the vitamin D in the world, but if the kidneys are not activating that vitamin D, it's not actually serving to do its function in control of calcium and phosphorus and bone health in general. It also is responsible for synthesizing a hormone known as erythropoietin. Most of us have heard of EPO before. If you haven't heard of EPO, think about Lance Armstrong. This was the drug that he used in order to boost his red blood cell mass so he could be a stronger athlete. But the kidneys are what determine the right amount of red blood cells that we have in our blood. And so as kidney function declines, we frequently see anemia can start to develop in those cases. The way in which we typically measure kidney function is through something called a basic metabolic panel. And those of you who have had lab work and looked at it before, some of these are going to look familiar to you. It includes the sodium, potassium, chloride, which are the electrolytes I talked about before. It does include a calcium. It doesn't always include a magnesium or phosphorus unless we make the decision to check that on our own. The carbon dioxide, which interchanges with something called sodium bicarbonate, which is basically baking soda, is how we manage our acid level in the blood, our pH. And so carbon dioxide is the way in which we measure it with the simple basic metabolic panel. It's not as comprehensive as actually checking the pH of the blood, but it can oftentimes give me a lot of idea of what's going on with the pH and acid control. Glucose, we think about diabetes or hypoglycemia, but these two are the ones I want to bring your attention to, which is the blood urea nitrogen and the creatinine. Both of these are what we typically use routinely as means of measuring how well the kidneys are filtering. The creatinine is more important, and that's the one I'm going to go through here in a couple of slides. The blood urea nitrogen can go up for a lot of different reasons. So that one I'm not going to talk about today because it can be a little more difficult to interpret what that means depending on what other health issues may be going on. But creatinine I want to talk about because this is what most of us know about on our basic metabolic panels, and this is how we measure our kidney function. First of all, creatinine is a muscle breakdown product. It has no role in our body. It's not toxic. It does nothing at all, but it's simply removed by the kidneys in such a reliable fashion that we can use it as a means to estimate how well the kidneys are working. Because we make almost the exact amount from day to day, it's very predictable for the most part in estimating kidney function in most individuals. Now, I'm going to make about the exact amount of creatinine today, tomorrow, a month from now, a year from now. It's not going to change very much in me. But how much creatinine I make might be a little bit different from a patient in my clinic. And so there are things that have to be thought about when you're talking about creatinine as a measure of kidney function, because the creatinine is not doing anything and it has nothing to really do with the kidney. It's simply that it's removed by the kidney, and when we measure it, we can estimate how well the kidneys are working. The other thing about it is it's very, very cheap and easy to measure. There are some new ways to measure kidney function that may be a little more accurate, but when it comes down to the cost, this is a few dollars versus several $100s to measure the kidney function. So this is what we're routinely using in most individuals. So what is a normal creatinine is really the question. And if you look at the lab sheets, it's going to say 0.6 to 1.4 milligrams per deciliter. Well, I just told you that not every one of us makes the same amount of creatinine each day. So to say that there's a normal range, I think is a little bit misleading. And being able to interpret that in the right setting really does make a difference. Also, there's no such thing as a low creatinine. Who cares if you have too little creatinine in your blood? If there's too much creatinine in the blood, it means your kidneys aren't removing it as effectively. But if there's too little, that doesn't mean anything. So to say that that even has a clinical significance is sort of silly. So the creatinine is used by an equation, and these are validated equations through regression studies. There's 3 different equations that we routinely use. I won't go into the details of them, but it is important that your provider knows which equation to use, because the standard equations we have been using for the last couple decades are actually not valid in patients who are very old, very young, or have other medical conditions. They may not be the right way to do it. It's measured in terms of a glomerular filtration rate, which is milliliters per minute. But what I tell my patients, and I think it's an easier way to think about this, is simply a percent of the kidney function, because men at age 20 will start with about 110 to 140. Women will be around 90 to 120. It's close enough to call it a percent that I think we can just simply use it that way, and it's an easier terminology for most of us. But the creatinine value depends on certain variables, especially age, gender, and race. And all of our equations require us to enter these things in order to get an accurate actual kidney creatinine. So what I typically tell people is usually around a creatinine of about 1 is usually normal in somebody. However, a creatinine of 1.0 in an 85-year-old woman would give that person somewhere between 50 and 60% of the kidney function they had at age 20. Whereas if you had a creatinine of 1 in an African-American male age 20, they would be functioning at 140. So you're talking about extremely different actual kidney function for the exact same lab value, which makes it so important for us to interpret that. Women have less muscle mass than men. And so I would argue that a creatinine of greater than 1.1 is never normal in a lady, unless it's a super athlete. African Americans have more muscle mass, so they create a little more creatinine. But even in most cases, 1.2 would be abnormal in ladies. And yet it's not going to show up as abnormal when you look down the line of problems or of abnormals on your basic metabolic panel. Your muscle mass decreases with age as well, and so that also is important to consider. The other test that we oftentimes do is a urinalysis, and the urinalysis can sometimes give us a little bit of information about kidney function. It's not the same as a creatinine, but there are some things I thought I'd bring up. First of all, leukocytes, which is called sometimes LCE or leukocyte esterase, and nitrites are products that we see in the urine in the setting of a urinary tract infection much of the time. There's a few other reasons why you might see white cells in the urine, which I'm not going to go into, because the vast majority, 99% of the time, if there's significant white cells in the urine, that's a UTI. And if it's nitrite in there, that's a slam dunk. That is a UTI. Okay. Glucose, I mentioned that one too, because if there's glucose in the urine, that can suggest diagnosis of diabetes or uncontrolled diabetes in known diabetics at times. But the two I bring you to on the bottom, which is protein and red blood cells, come back to that first slide where we talked about how the filter not only has to filter a certain amount of blood, but it also has to hold on to things that aren't supposed to end up in the urine, whereas eliminating the toxins and waste products. And so if we see protein or red blood cells in the urine, that's something that may need a nephrological evaluation. Now, blood can come from the kidneys or many other places, so it's not always kidneys, but protein, it's always coming from the kidneys, okay? So chronic kidney disease is defined as having a percent of kidney function of less than 60% or the presence of protein in the urine. You don't need both to have kidney disease. You could have 100% kidney filtration function but leaking protein. Blood, if it's leaking into the urine and there's no protein and the function is normal and it is coming from the kidney, it could be chronic kidney disease in some cases as well, but those folks, we would need a biopsy of the kidney to know. Why does kidney disease matter is really the question, because if you're not on dialysis but your kidney function isn't normal, most of the time people don't feel abnormal, they don't have symptoms necessarily, but you can see disruption in those salts, the acid-base status, and things like vitamin D, anemia, problems that can be associated with any of the kidney functions that we talked about. But not only that, a decrease in kidney function has an inverse relationship with increased risk of heart disease. That means as the kidney function goes down, the risk of having heart disease goes up. When we look at somebody on dialysis, for instance, a 20-year-old on dialysis has the same heart risk as an 80-year-old who doesn't have any kidney disease whatsoever. So it confers a significant heart risk. So we care about blood pressure, we care about cholesterol, and controlling things like diabetes and any other risk factor in patients who have chronic kidney disease. We're more aggressive about doing so. If there's chronic kidney disease in the first place, you have to worry about, will kidney disease continue to progress, or will function decline further? Will there be a time when the kidneys won't do what they need to, or be so severely affected that dialysis would need to be initiated? And so if you do have kidney disease, by seeing a provider or trying to care for the kidneys, the goal is to help prevent the progression of disease and ending up without kidney function. In chronic kidney disease, I think it's pertinent to say, in ladies that are interested in getting pregnant, it can be very difficult to conceive if there is chronic kidney disease. Once your kidney functions down to around 30%, there's about a 60 to 85% chance of premature birth. By the time somebody's on dialysis, the likelihood of even conceiving is minuscule at that point. And so protecting the kidneys, if you're interested in bearing children, is a very important factor as well. The reason I'm talking about urinary tract infections here is because they are very common in women. Most women will have 2 to 3 UTIs in their lifetime. Men rarely have urinary tract infections, and a lot of that simply has to do with the anatomy. The urethra, which is the tube we urinate through between the bladder and the outside, is very short in women. It's usually about 1/2 inch, a centimeter or two, versus men it's much longer. And so simply the physical barriers for a bacteria to find its way into the bladder is much less. Bladder infections are what we typically are thinking about when we have a urinary tract infections, and hopefully that's all they are. And in women, a bladder infection can be treated very simply with sometimes 1 antibiotic dose is adequate to clear the UTI, but usually we do 3 to 5 days of antibiotics in order to ensure that the infection is cleared. Kidney infections, on the other hand, are something significantly more severe. People with kidney infections will usually appear very sick, nausea, vomiting, fevers, back pain. When this occurs, we see that we need to treat patients for a much longer period of time. Usually 2 weeks is the appropriate treatment course for that. And kidney infections, the most common setting I see them in is a UTI in the bladder, which is not treated in due time, and eventually the bacteria can find their way up the ureters, up into the kidney. But the ureters are quite long, and so you can see that that would provide an anatomic protection from getting kidney infections most of the time. And so if somebody does get kidney infections, especially multiple times, then that's something that needs to be evaluated, okay? Now, I will mention one thing here real quick, that the kidneys themselves don't have nerves in them, so kidneys generally don't hurt. But there are 2 exceptions, kind of a third exception. One is an infection, and it's because the kidney swells in infection and the capsule has nerves in it, so that can hurt. Or if there's bleeding into the kidney, if there's actually some trauma or some reason why blood is filling the kidney, that can be painful. Kidney stones, we always think about, that's the third one, hurting as well, but the kidney stones are passing into the ureter, and the ureters have a lot of nerves in them, and so that can be very, very uncomfortable, very painful. In urinary tract infections, if they happen more than once, we have to think about, are these recurrent, repeat, or resistant infections? And what I mean by that is there's an infection occurred, we treated it, it went away, and then another infection occurred down the road a few months later, for instance. Or did the infection occur, did it get treated, but as soon as we stopped antibiotics, it came right back? And that's as opposed to an infection where we start antibiotics and find out that they don't take care of the UTI. Some of the factors that contribute to having recurring urinary tract infections are listed here, one of them being menopause, because after menopause, because of the drop in estrogen and progesterone, the lining of the vagina and also the urethra itself actually thins. The urethra can become shorter, sometimes it can kink, and that can increase the risk of having a UTI. Sometimes in those cases, simply a little bit of vaginal estrogen cream, such as Premarin, can actually bring back the lining and the integrity of the urethra and reduce those urinary tract infections from recurring. Some infections can actually lead to stone formation, and that's where we especially worry about in an infection of the kidney, where if a stone forms, even if you're using the right antibiotic, the bacteria can hide out on those stones and keep coming back. And until the stone is removed, a lot of times we have to continue antibiotics, or we're not going to succeed in our treatment of the UTIs. I mentioned intercourse, that's a risk factor, and I recommend anybody who has urinary tract infections urinates after sexual intercourse. Diabetes is also very common because of the sugar in the urine, and that's a very happy environment, shall we say, for the bacteria. They thrive on sugar, and they will recur if there's frequently sugar in the urine, so controlling diabetes is extremely important. Immune-suppressed individuals may be more likely to get UTIs as well. And then the last thing I wanted to talk about was reflux. I'm going to just go back to this previous slide. And reflux is the concept that when the bladder contracts, when we're going to the bathroom, that urine goes up instead of only out it can actually reflux up into the ureters, and that can predispose people for having kidney infections. And that does need to be evaluated, and we have certain imagings and urodynamic studies we can do in order to find out if that's what's going on. So that's all I've got for today. Thank you for coming. Do you guys have any questions? Go ahead.
Mostly it's the guys that are doing weightlifting take creatine.
Ah, yeah.
How does that react? How does that compare with the creatinine?
Excellent question. So creatine is a muscle building product, and that's why some of the bodybuilders will use it as a means to increase their bulk. Unfortunately, creatine does interfere with our lab assay, and so if somebody's taking creatine supplements and you don't pick up on it, you could have a creatinine that's much higher than you would expect, and that could lead you to think, oh, well, this person has kidney disease. Well, if you don't ask the patient if they're taking creatine supplements, then you may miss out on something like that. So those folks, simply have them stop taking the creatine supplement or recheck the labs. Usually I give it about a week for it to come out of the body, just to reduce the risk that it's gonna interfere with my lab test. Go ahead.
What does it mean if the carbon dioxide is way high over the chart, and how can you bring it down?
That's a challenging question to actually answer, because the carbon dioxide can be high, and that can represent that you either have too much acid in the body or too little acid in the body, or it could be low, and the same thing can be true. It can either be too much acid or too little acid. And what it comes down to is that acid, the sodium bicarbonate, which is the baking soda we talked about, carbon dioxide and bicarbonate are interchanged in the body. And carbon dioxide is usually thought of as acid, whereas the bicarbonate is more thought about as a base. And without going into too much detail, if you have acidosis, meaning you're building up acid because you're not breathing enough, your carbon dioxide is high, and that tells you have too much acid in the body. On the other hand, if it's the kidney's inability to get rid of acid, then the carbon dioxide will be low. And the problem really comes to the lab test that we're measuring carbon dioxide, which is interchangeable with something that can either be acid or a base. And so to interpret it, I have to look at the individual and find out, if it's a respiratory problem, do they have lung disease? So it's frequently high in people with emphysema or uncontrolled sleep apnea. On the flip side, if it's the kidneys that aren't doing it, oftentimes it can be, if the kidneys aren't taking care of the acid, then you'll see a low carbon dioxide. And that's usually evident by looking at the kidney function and other factors, other causes of acid production, for instance, a very high protein diet, or if somebody's very sick, septic, you can have acid produced from lactic acid, for instance. So there's a lot of places where that can come. So that simply put, that's by itself is a difficult thing to sort out with simply the metabolic panel alone. And that's where it comes into play. A lot of times you actually just directly measure the pH in the blood, and then you can interpret that bicarbonate a lot better and figure out where it's going on. And to make things even more complicated, you could have a respiratory acidosis and you could have a kidney acidosis at the same time on top of each other. You could have a normal or a normal carbon dioxide of 24 and still have a person with a lot of acid in the body. But they wouldn't look very well with a bunch of acid. So.
What you just told us, I think that the only thing you can do then, the best thing is to try to get some more sleep. Because you said something about sleeping.
Well, sleep apnea is where people snore and they stop breathing when they're asleep. And that's the problem with that. It's not a lack of sleep, it's a lack of adequate sleep. And so people with sleep apnea sometimes have to use like a mask to keep the airways open, or sometimes surgery. It's frequent with obesity, so weight loss is frequently recommended as well. So, go ahead.
For preserving kidney function, say like in stage 3 and 4,
Okay.
what do you recommend for protein intake?
So stage 3, just for those of you who don't know, means that you're between 30 and 60%. Stage 4 is between about 15 and 30%. And so the recommendation is 1 gram per kilogram of body weight or less is what we recommend. The reason why we recommend a low protein diet is protein causes the kidneys to work a little harder. And once kidney disease exists, we don't want to have the kidneys working hard because that will kind of wear them out sooner. And so anywhere between 0.8 and 1 gram per kilogram for a person. So if you weigh 160 pounds, that's about a 70 kilogram person. But it's actually really interesting because even though the studies have said we should limit how much protein people have in chronic kidney disease, it's actually never made it as a formal recommendation from the kidney societies. So on the other hand, 70 grams of protein is a fair amount. I mean, a chicken breast has about 30 grams. So if you're taking in more than 70 grams of protein in the first place, that's quite a bit. But yeah, I do bring that up with my patients frequently. And there is no difference between stage 3 or stage 4 as far as how much protein you're supposed to take in. It's about the same.
Do you ever go down the route of plant versus animal?
I don't, but that's a good question because animal proteins are more likely to produce more acid. Just the type of amino acids that make up animal proteins, they're more acidic. You can't eat anything without getting a little protein, basically, because cells have protein in them, and food is made up of plant or animal matter with cells. So no, I don't necessarily do so. Now, when people's kidney function gets very low, they won't want to eat animal protein. They'll really, the idea of eating meat can be a big turnoff for them. But at that point, you're already getting to the point where you're thinking about starting dialysis. Go ahead.
If someone has had kidney stones, are they more likely to have kidney disease?
That's a good question. Not necessarily. Kidney stones can injure the kidney in various ways, especially if there's infections that are associated with them, or if the kidney stones are blocking off urinary flow. So if they get stuck in the ureter and one kidney just can't flow, if it's left there for too long, and usually around 6 weeks, 4 to 6 weeks is when we start to see that kidney function deteriorate. So usually with a kidney stone, I'll wait 2 to 3 weeks to see if people can pass them if they're small enough to pass on their own. But once you're starting to get beyond that point and they're blocking off urinary flow, I ask the urologist to get involved and get those out of there because then you're left with one kidney function that has declined. If you have very severe kidney stone disease, something called nephrocalcinosis, where the kidneys just almost calcify because there's so much stone burden, then that can cause severe kidney failure as well. Typically, a stone only blocks one side, though, and you can do quite well with one kidney. But if it were to block off in the urethra and block both sides of the urine output, then that could really be a problem if it was long-term. But you would know because you'd stop peeing and you'd start swelling up, you'd feel awful. And so it's not a very, it's not subtle. Okay.
What do you think about the cranberry juice recommendation for preventing?
So there is evidence that cranberry juice will reduce the risk of getting urinary tract infections. It's a hostile, it creates a hostile environment for bacteria, and I think it's a great.
Or what is it?
I believe that's a major part of it. I don't know all of the specifics on why that doesn't allow the bacteria to grow. I mean, it's not just the acidity, it's some of the other components, because urine is typically acidic anyway, and usually it's around pH of 4.5 to 6.5, so that's probably not playing a big role. But they also, one interesting thing is actually cherry juice is just as effective or more effective in some reports. And so you can buy a combo of cherry and cranberry, or you could just drink cherry if you prefer. The problem with both of those is there's a lot of sugar in them, so that's. So if you're diabetic, for instance, it may not be good.
Preventive or also to treat?
I would say in this day and age that we probably wouldn't recommend somebody using that to treat because we have antibiotics,
Yeah.
but more for prevention. And if you're somebody who's more prone to having it and you like those juices and it's not an issue with too much sugar, then they absolutely can reduce the amount of urinary tract infections. And it may reduce them as much as half in some people.
Any other diet recommendations?
Not that I.
Just cherry and cranberry.
Yeah, I mean, those are the ones that we know that actually change the urinary environment. But dietary recommendations for somebody who's diabetic, you don't want them taking a lot of sugar because that sugar ends up in the urine. So.
Can you just eat cherries or cranberries?
I don't know the answer to that question, actually. You'd have to probably eat a lot of cranberries. I don't know. Cherries, I'm not sure about that. I'm sorry.
Because they do have tablets or capsules of cranberry,
Mhm.
and I don't know if they work as well or not.
Supposedly, I mean, to do these
imagine.
to do
The
these
guy who
studies.
sells it says.
Well, you'd have to do these pretty large studies, and that could be very expensive. And the people who are selling cranberry tablets and juice are not motivated to do
Yeah.
big, expensive studies. In fact, they're much happier if we just think it works and we're not even sure, because then they keep selling their product. Any more questions? Well, thank you for having me. I appreciate
Thank you.
me being allowed to be here.
Thank you.